USMLE Practice Test 2026 United States Medical Licensing Examination Exam Questions and Answers. Question 1. A 45-year-old male presents with sudden onset, worst headache of my life. A CT scan shows blood in the subarachnoid space. Which of the following is the most likely cause? Option A, berry aneurysm rupture. Option B, arteriovenous malformation. Option C, hypertension. Option D, trauma. The correct answer is option A, berry aneurysm rupture. Rupture of a berry aneurysm in the circle of Willis is the most common cause of non-traumatic subarachnoid hemorrhage. Question 2. A 65-year-old smoker presents with weight loss and a persistent cough. CXR shows a central lung mass. Biopsy reveals small, round cells with scant cytoplasm. What is the most likely diagnosis? Option A, adenocarcinoma. Option B, large cell carcinoma. Option C, small cell carcinoma. Option D, squamous cell carcinoma. The correct answer is option C, small cell carcinoma. Small cell carcinoma is centrally located and associated with smoking. It often exhibits paraneoplastic syndromes. Question 3. Which of the following biochemical pathways is primarily affected in G6PD deficiency? Option A, glycolysis. Option B, pentose phosphate pathway. Option C, citric acid cycle. Option D, gluconeogenesis. The correct answer is option B, pentose phosphate pathway. G6PD is the rate-limiting enzyme in the pentose phosphate pathway, which generates NADPH to keep glutathione reduced. Question 4. A patient with vitamin B12 deficiency is likely to show which of the following on a peripheral blood smear? Option A, microcytic cells. Option B, hypersegmented neutrophils. Option C, target cells. Option D, schistocytes. The correct answer is option B, hypersegmented neutrophils. Vitamin B12 deficiency leads to megaloblastic anemia characterized by macrocytosis and hypersegmented neutrophils. Question 5. What is the mechanism of action of heparin? Option A, inhibits vitamin K epoxide reductase. Option B, activates antithrombin 3. Option C, directly inhibits thrombin. Option D, inhibits COX-1. The correct answer is option B, activates antithrombin 3. Heparin binds to and enhances the activity of antithrombin 3, which inactivates thrombin and factor XA. Question 6. A child presents with slapped cheek appearance and a lacy rash on the extremities. What is the causative agent? Option A, parvovirus B19. Option B, measles virus. Option C, rubella virus. Option D, varicella-zoster virus. The correct answer is option A, parvovirus B19. Parvovirus B19 causes erythema infectiosum, fifth disease, characterized by the slapped cheek rash. Question 7. A 30-year-old female presents with butterfly rash and joint pain. Lab tests show positive anti-dsDNA antibodies. What is the diagnosis? Option A, rheumatoid arthritis. Option B, systemic lupus erythematosus, SLE. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option B, systemic lupus erythematosus, SLE. Anti-dsDNA and anti-Smith antibodies are highly specific for SLE. Question 8. Which cardiac valve is most commonly affected in 4 drug users with endocarditis? Option A, mitral valve. Option B, aortic valve. Option C, tricuspid valve. Option D, pulmonary valve. The correct answer is option C, tricuspid valve. Tricuspid valve endocarditis is common in 4 drug users, often caused by Staphylococcus aureus. Question 9. A patient presents with polydipsia, polyuria, and a fruity odor on their breath. Which of the following is the most likely diagnosis? Option A, diabetes insipidus. Option B, diabetic ketoacidosis, DKA. Option C, hyperosmolar hyperglycemic state. Option D, hypoglycemia. The correct answer is option B, diabetic ketoacidosis, DKA. DKA is characterized by hyperglycemia, ketosis, causing fruity breath, and metabolic acidosis. Question 10. Which part of the nephron is the primary site of action for thiazide diuretics? Option A, proximal convoluted tubule. Option B, loop of Henle. Option C, distal convoluted tubule. Option D, collecting duct. The correct answer is option C, distal convoluted tubule. Thiazide diuretics inhibit the Na+/Cl symporter in the distal convoluted tubule. Question 11. A patient presents with a moon face, buffalo hump, and abdominal striae. What is the likely diagnosis? Option A, Addison's disease. Option B, Cushing's syndrome. Option C, Conn's syndrome. Option D, pheochromocytoma. The correct answer is option B, Cushing's syndrome. Cushing's syndrome is caused by excess cortisol, leading to these characteristic physical findings. Question 12. What is the hallmark finding of celiac disease on intestinal biopsy? Option A, villus atrophy. Option B, crypt abscesses. Option C, non-caseating granulomas. Option D, transmural inflammation. The correct answer is option A, villus atrophy. Celiac disease causes blunting and atrophy of the intestinal villi due to gluten sensitivity. Question 13. Which cranial nerve is responsible for the gag reflex, sensory component? Option A, CN7. Option B, CN9. Option C, CNX. Option D, CN12. The correct answer is option B, CN9. The glossopharyngeal nerve, CN9, provides the sensory limb of the gag reflex. Question 14. A 60-year-old male presents with tremors that improve with movement and a shuffling gait. What is the diagnosis? Option A, Huntington's disease. Option B, Parkinson's disease. Option C, multiple sclerosis. Option D, Alzheimer's disease. The correct answer is option B, Parkinson's disease. Parkinson's disease is characterized by resting tremor, bradykinesia, rigidity, and postural instability. Question 15. What is the primary neurotransmitter involved in the reward pathway of the brain? Option A, serotonin. Option B, GABA. Option C, dopamine. Option D, acetylcholine. The correct answer is option C, dopamine. Dopamine is the key neurotransmitter in the mesolimbic reward system. Question 16. Which antibody is the first to be produced in an initial immune response? Option A, IgA. Option B, IgA. Option C, IgG. Option D, IgM. The correct answer is option D, IgM. IgM is the first antibody isotype produced during a primary immune response. Question 17. A patient presents with honey-crusted lesions around the mouth. What is the most likely diagnosis? Option A, impetigo. Option B, eczema. Option C, psoriasis. Option D, cellulitis. The correct answer is option A, impetigo. Impetigo, often caused by S. aureus or S. pyogenes, typically presents with honey-colored crusting. Question 18. Which of the following is a classic sign of right-sided heart failure? Option A, pulmonary edema. Option B, jugular venous distension, JVD. Option C, paroxysmal nocturnal dyspnea. Option D, crackles in lungs. The correct answer is option B, jugular venous distension, JVD. Right heart failure causes systemic venous congestion, leading to JVD, peripheral edema, and hepatomegaly. Question 19. A tall, thin patient presents with long fingers and a history of lens dislocation. Which condition is suspected? Option A, Marfan syndrome. Option B, Ehlers-Danlos syndrome. Option C, osteogenesis imperfecta. Option D, homocystinuria. The correct answer is option A, Marfan syndrome. Marfan syndrome is a connective tissue disorder involving FBN1 mutations, characterized by arachnodactyly and ectopia lentis. Question 20. What is the initial treatment for an acute asthma exacerbation? Option A, inhaled corticosteroids. Option B, albuterol, SABA. Option C, long-acting beta agonists, LABA. Option D, oral prednisone. The correct answer is option B, albuterol, SABA. Short-acting beta agonists, SABA, like albuterol, are used for rapid bronchodilation during acute attacks.